Thank you all for joining us today. I will turn it over to our moderator, Nicole, to get us started.
Hello, everyone. Welcome and thank you for joining us today. My name is Nicole Nguyenga, and I'm the Policy and Advocacy Officer at the GATC and today's guest moderator. In celebration of World No Tobacco Day, we are elated to discuss the impact of tobacco on food security. And as you may already know, this webinar is hosted by Ash and co-hosted with the GATC. Before we dive any deeper into the content, I would like to start by introducing our brilliant lineup of speakers today. First, we have Dr. Raphael Lencucha, who is an associate professor at McGill University. As our second speaker for today, we have Dr. Jin Kim-Mozeleski, who is an assistant professor at the Case Western Reserve University at the University, School of Medicine. And last but definitely not least, we have Ms. Carrie Dahlquist, who is the Tobacco Control Program Manager at the DC Department of Health. Just as an overview, I will be providing a high-level summary of tobacco's impact on food security. Our speakers will then elaborate on 1, the impact of tobacco farming on food security, 2, the impact of tobacco on food deserts, highlighting the linkages between poverty, food insecurity, stress, and tobacco use. And lastly, we will have a local example of work that DC is starting on the overlap between tobacco use and food security and addressing tobacco use in food access environments. I'm sure that we will all have excellent questions for our panelists today, and we invite you to submit your questions to the Q&A box, and we will do our best to relay our questions to our presenters. Now, diving into our introduction, just to get us all started today, what is food security? Based on the definition on our screens, food security exists when all people at all times have physical and economic access and sufficient and safe nutritious food. And this food should meet their dietary needs and food preferences for them to live an active and healthy life. As we all probably know, food security is an essential social determinant of health. So it's unsurprising that food insecurity is often associated with poorer health outcomes and greater odds for chronic illness. In the spirit of today's webinar theme, and also just to bear this in mind, today over 8,000 million people are affected by hunger and food insecurity. When we speak of food insecurity, we have 4 elements that come to mind that are often discussed. And these elements really make up food security. So this comes to availability, and this is defined when there is an availability of quality and nutritious foods for everyone. And this is often impacted by production, distribution, and trade. And the second element would be accessibility. And within accessibility, this is defined by the ability for individuals and households to actually purchase and get the required amount of food to have a healthy and nutritious meal. And to keep this in mind, it's important to keep in mind that when there is available food, it doesn't necessarily mean that there's accessibility to food. And what this means is that accessibility is often impacted by affordability, allocation, and preference. And we have third, food utilization, which is really commonly understood as the way the body makes use of various nutrients. And this is often associated with the body actually having sufficient nutrient energy intake with the food that we have. And lastly, there's stability. And what this really means is that there's stability of all of these different elements. And basically, an example would be that even if one has food intake that is adequate for today, it doesn't really necessarily mean that you are food secure. You can still be considered food insecure if there's an inadequate access on a periodic basis. And this is mostly because it also impacts an individual's or a household's nutritional status. So where is the intersection between food security and tobacco control? Often this intersection comes in tobacco production and consumption because in both of those elements, we see that food insecurity or food security is negatively impacted in all four dimensions that we just mentioned. We have research that demonstrates really that there are negative impacts on physical availability of food and the economic and physical access to food when there's tobacco production and tobacco consumption. When referring to tobacco control, it's important to take into account that we are referring to both tobacco demand, which is when there's tobacco consumption, as well as tobacco supply, which is often acquired through production. And for tobacco consumption specifically, we've seen that expenditure on tobacco, particularly on cigarettes, represents a major burden for the poorest of households, if there are individuals that smoke in that household. And tobacco expenditures tend to really exacerbate the effects of poverty and cause significant deterioration of living standards amongst those that are already poor. A study from Bangladesh actually found that an estimate of 10.5 million people could have adequate diets if the money they spent on tobacco was actually spent on food instead. And aside from consumption, studies demonstrate that the impact of tobacco production on food security is also negative. And tobacco production has been associated and linked to food insecurity in various countries. And this link between tobacco and food insecurity has been attributed in part to labor hours that are required to produce tobacco, because it's very rare that farmers that are producing tobacco also have time to produce anything else. And as well as the quality of land that is used to produce tobacco. So as opposed to producing food, there tends to be an opportunity cost because they're producing tobacco instead. And that's what that quality land is actually being used for. And there's also the harsh impacts that tobacco production tends to have on the soil, which hinders production of food. An example would be in neighboring Malawi, neighboring to Mozambique, for instance. A lot of Malawi tobacco farmers have tended to go to Mozambique, which is a neighboring country, to still get some access to food because their soil is often damaged by tobacco production. It's important to also note the role of the FCTC in all of this. For many of you that already know, the Framework Convention for Tobacco Control is an evidence-based global health treaty that really tackles the causes of the tobacco epidemic, including cross-border effects such as trade liberalization and direct investment, tobacco investment, and many more. And this includes measures to decrease both tobacco supply and demand, and in other words, really decreasing the production and consumption of tobacco. And as a last point, it's really important to really understand and to really acknowledge the FCTC or the opportunities presented by the FCTC to improve policy coherence between tobacco control and food security. Now, without any further ado, I would like to introduce Dr. Raphael Lencucha and welcome him to take the center stage. Welcome, Dr. Raphael Lencucha.
Thank you very much, Nicole. I just, if you could stop sharing your slides, then I'll be able to access my own.
Absolutely.
And it's a pleasure to be here today to speak to the topic of tobacco farming and situated in relation to food security. And I'll be doing so in a broad sense, looking at the indirect and direct relationships between food security and in relation to tobacco farming households, but also in the broader agenda of transforming food systems to be more sustainable, healthy, and other positive qualities that we seek in our food systems. So to start, I want to look at where tobacco is grown, because this is an important feature of considerations when we think about tobacco farming in relation to food security. So on your left, you see the top 10 tobacco producing countries. And there's it's important to note the significant variation in the way that tobacco is grown across these various countries. So if you look at your top right hand corner of the slide, you can see that the majority of tobacco is grown on small plots of land, so smallholder farming on the continent of Africa and as well as Asia. So what this means is that millions of households have a stake in tobacco growing and are impacted by its, as we'll see, detrimental effects. And importantly, the countries that are most reliant on tobacco tend to be the poorest. So there's a bit of a cause and effect relationship here, which I'll get into in a moment. But if you can just look at the bottom of your screen, we see that based on the Food Security Index, Malawi and Mozambique, which are major tobacco producing countries, are also the least food secure. And this kind of segues into the way that governments view tobacco. And often it's viewed as an economic commodity that can contribute to economic development. So this statement here is quite common across countries where tobacco is grown, where government officials in the economic sector make statements like, we want businesses such as British American Tobacco to continue to grow. If they win, we win. The interesting point here is that this statement was made in Kenya in 2018, and British American Tobacco filed a suit against the Ministry of Health in 2014 for regulations that were FCTC compliant, and it created a 3-year prolonged, expensive litigation, which they ended up losing. But this is just to kind of view this in the context of an industry that has ingratiated itself with governments to the extent that it can take government to court, and still we can still hear statements being made from the economic sector to the extent to the effect that if they win, we win. And where do governments think that by having tobacco growing in their countries that there will be wins? One dimension of this is in relation to the broader economy of the country. So the view that tobacco as an economic commodity contributes to foreign exchange earnings as well as broader GDP measures. But if we look at the figures, often these statements of the contribution of tobacco growing to the broader economy are exaggerated. The GDP of even the most dependent tobacco growing countries rarely exceeds 5%, although we have estimates that move closer to 10 and 15%. But this is just to say that without tobacco, these countries will survive. The important point to consider is where alternatives would come from in the growing of tobacco. Another common assertion and a consideration for governments is in the development of rural livelihoods. So, and this is an important point to consider, as there are often limited economic opportunities in rural communities. So tobacco, again, is viewed as a pathway to economic prosperity. But if we test this assertion in relation to the facts that we have about tobacco growing households, so this is from our research in various countries, at best, households are making approximately $1 per day from tobacco growing. Numerous studies have confirmed that the gains from tobacco growing are minimal in economic terms. So Chingoso in Zimbabwe and colleagues had found that 60% of tobacco farmers were in debt. We found, our colleagues, Peter Magati and others in Kenya have found that tobacco farmers tend to be 60 to 80% below the poverty line. So we're talking about very significant economic detriments in terms of growing tobacco. And why is this the case? Well, tobacco is highly costly in terms of the inputs, fertilizer, herbicide, pesticides, and it also is highly labor intensive. So families need to dedicate many hours to the cultivation of tobacco in order to receive a harvest. And in the end, when the labor costs and the input costs are deducted from the price that is, or the profit or the income that's received from tobacco, which again is another issue, structural issue, is the price received is often it's quite low and unfair. We see a very small benefit and gain from the growing of tobacco in economic terms. So in the end, we can ask the question, who is winning? And who's clearly winning is not governments, and it's not farming households, it's the tobacco industry. So we might ask then, if farmers aren't winning, farming households aren't winning, why do they continue to grow tobacco? And what we've seen across countries is that an important feature of this context is the provision of a structured supply chain. So many smallholder farmers, the majority of smallholder farmers, have contracts with leaf buying companies who provide the capital or the direct inputs to actually cultivate the crop. Without this structured supply chain, often in rural communities, there is a lack of capital to grow, to purchase inputs, to grow other crops, and also the instability in terms of where those crops will go in terms of sale. So this leads us then to the question of how do we pursue alternatives? So there are these structural, important social and political conditions that continue to perpetuate tobacco growing. And we also know by now that it doesn't benefit farming households and communities or governments in the ways that that narrative of prosperity is intended to persuade us to believe. So what are some of the barriers to pursuing alternatives? If tobacco is so bad, then there must be an opportunity to pursue alternative crops to generate cash for and food for local communities. Well, one of the pieces that is important to consider is that agriculture and the global market of cash crops, even including food crops, is highly fraught. So we see countries like Malawi struggling to compete, where countries like China or the United States invest upwards of $200 billion to agricultural subsidies. So a country like Malawi it's difficult to compete, for example, in the international market for the growing of something like soy or corn, where the subsidies in other countries artificially lower the price on the global market. So this is just one piece of the international puzzle that these countries face, and this adds complexity and nuance to the consideration for the pursuit of alternatives. So certainly international markets are one consideration, but there are also struggles in terms of how to kind of move in that direction. So another consideration then is to think about national, regional, or even local markets for food-based crops. And what can be done? So I want to end with this slide. And there's a lot of technical things that governments can do, but I want to leave with 4 key messages. First, we need to reduce tobacco industry influence, both in terms of the political power they exert, but also in terms of shaping the narrative. So when we began this research 12 years ago, the idea that tobacco was a lucrative economic commodity was a narrative that we would hear all the time, but without very much evidence. Now we have the evidence to say that this is not the case. So we need to disrupt this narrative to shift to a pursuit or even an imagining of what alternatives could be. Governments and also civil society need to support communities to identify sustainable and healthy food crops. In addition to that, within governments, we need to shift mandates to support these sustainable, healthy, and just food systems. So in this respect, what we see is that tobacco has, as an economic commodity, has been entrenched in national development plans of countries and used to justify the perpetuation of the commodity as an economic development strategy. So one piece of that is to recognize that it isn't bearing the fruits that it was intended to bear, and that then the mandates need to shift to alternatives. And finally, to identify and support local, national, and regional markets for sustainable and healthy food crops. And this kind of fits with a broader global agenda for the transformation of food systems that is tied to the Sustainable Development Goals and is gaining traction in various realms, both in public health, but also in agriculture and economic development. I want to really just end by thanking my incredible team, without which I would have no information to present to you today. So I want to also extend my thanks to them as well.
Wonderful. Thank you so much, Raphael. And thank you for really highlighting the intersection between the political landscape, alternatives, and just tobacco production in general. And it is really indeed important to continue to explore alternatives that will be beneficial to national governments and to farmers alike. Now I would like to welcome Dr. Jin Kim-Mozeleski for her presentation, please. Welcome.
Thank you. So thank you. And in keeping with the theme of we need food, not tobacco, my presentation, I'm going to be really talking about the intersection of food insecurity and tobacco use. And most of this is coming from a public health, epidemiological, and lived experiences perspective. And the recognizing that the two issues of food insecurity and tobacco use cluster in particular communities. It's not random, and it tends to be those communities that are low income and historically disinvested. And so in doing so, again, I'm really focusing on the people who are affected, who are impacted both by tobacco use and food insecurity, and hoping to draw from health equity lens to understand and address both issues in tandem. So these are kind of the three broad topics that I'm going to go over in this presentation. And the caveat is that a lot of this work, or much of this work, is coming from a US context and a high income country context. So please keep that in mind as I go through my slides. So a lot of my work focuses on tobacco related health disparities as they have to do in the US. And in our context here in our country, we have seen that tobacco use prevalence has declined over the previous decades. But with that, we have seen socioeconomic disparities in smoking emerge, such that they are wider now than they've been in previous decades. So as smoking has gone down, there is clearly a gradient in who is remaining a tobacco user and who continues to consume the bulk of tobacco in our country, in the US. Even if we break out that data with levels of income or poverty and race and ethnicity, we continue to see this disparity with every racial and ethnic group that you see on this slide here. And of course, with the Asian population in the US and Hispanic Latino population, there's a lot of heterogeneity that's not captured by these labels. And so one of the questions then is, why do we continue to see such disparities in smoking that have emerged and have continued? And so it really has to do with the difficulty of quitting and who is continuing to consume tobacco. And this has to do with the larger forces that keep pushing the use of tobacco. And I really want to emphasize that it's most people who smoke, regardless of their socioeconomic circumstance, they desire to quit and they attempt to quit each year. But it is that the success rates can vary based on one's socioeconomic circumstance. And it's that when one is surrounded by forces that perpetuate tobacco use, it is much harder to actually be able to quit. So as an example, there are a number of studies sort of quantifying different communities and when they look at different food retail outlets that accept food assistance benefits. So in the US, that's the Supplemental Nutrition Assistance Programs. They find that those outlets that accept those food assistance benefits, there's a higher proportion of tobacco marketing in those places, and particularly price promotions. And it's not random that we're seeing such socioeconomic disparities in smoking. And while there have been many tobacco control initiatives that have worked for the overall population to reduce smoking prevalence to what it is now in the US, it really has not been equitable. And so health equity requires that we go further upstream to understand the social drivers or the social determinants of tobacco use and for health. So in doing so, one of the frameworks that I draw from in my work is this fundamental cause theory that was put forth by two sociologists, Bruce Link and Joe Phelan in the 90s. And this theory really largely asks the question of what are the risk factors for the risk factors? So if we know that tobacco use is a risk factor for for health, what are the risk factors for tobacco use, as an example. And rather than thinking about the individual-based risk factors, such as, let's say, genetic predisposition, this theory really encourages us to think about what are the systems of exposures, those factors that that expose one group of people disproportionately compared to another group and create health disparities, particularly these health disparities related to tobacco use, as I'm doing in my work. Here is an example of an article that was published in Tobacco Control using a system science perspective to outline some of the fundamental causes of smoking. And I'm not a system scientist myself, but what I can really truly appreciate about system science thinking is the importance of feedback loops. So for instance, if a person is feeling under a lot of financial stress, they may then smoke to relieve that stress, but by smoking, they are disproportionately spending money on cigarettes, and that then feeds back into financial stress, which then feeds back into smoking. So that's an example of a particular feedback loop. And so this article highlights the fundamental causes of smoking that have to do with the structure, as you see in the bullet points in the middle. The figure to the right here, it's not meant for you to be able to read this. You'll have to really squint at these tiny fonts, but it's to really show the interconnections and the complexity of what's going on across these feedbacks. And I'll draw your attention to financial strain, which these authors have put forth as a fundamental cause of smoking, and really drill down further to financial strain. And a key aspect of financial strain that is highly relevant to social and health policy and today's topic, which is food insecurity. I'm talking about food insecurity at the household and individual level. And the definition that I'm drawing from is the USDA, US Department of Agriculture's definition, because this is what we use in the United States to assess population levels of food insecurity. And what you're seeing in the blue box to the right is that, of course, there are inequitable disparities in food insecurity, with households who are below the poverty line having much higher prevalence of food insecurity than their higher income counterparts. And it's not surprising that we see that. There's a number of epidemiological studies that show the high prevalence of food insecurity among people who smoke, and vice versa. Among people who smoke, the level of food insecurity. And I'm showing this graphic to really illustrate that as food insecurity prevalence increases, so does the prevalence of smoking. And we see this at the population level. And it's very clear that we see this gradient of who is smoking and who is experiencing the most severe levels of food insecurity. So when I first started focusing on the intersection of food insecurity and tobacco use from a public health perspective, from an epidemiological perspective, this was almost 10 years ago, I was met with some skepticism by folks that food insecurity may be just another proxy for poverty, so that any significant epidemiological association or public health association that was getting picked up was really capturing poverty and smoking. But as you may know, poverty is highly complex, and so is food insecurity. It's also highly complex. So as a way to highlight this issue to the scientific community, we conducted this review study a few years ago to look for studies that measured both food insecurity and tobacco use. And even if the relationship between the two was not necessarily a focus. So in doing so, we were able to conclude that across these multiple samples, whether it was a general population or clinical samples or very specific health disparity groups, including folks who are experiencing housing insecurity and homelessness, that we found that these are risk factors for one another. And we started to highlight what are some of the potential mechanisms that may be going on at the people level or the public health level. So we conceptualized this a working model of this bidirectional association. And first of all, I just want to highlight your attention to this bottom left box and the social and structural factors, that it's very important to keep in mind that the social and structural factors and inequities can underlie who is experiencing food insecurity as well as tobacco use. And so some of the mechanisms that you see here are outlined in bullet points. And this is not exhaustive by any means, but it gives you a sense of the complexity of the psychological, physiological, economic, and social forces at play. And in my work, when I see this, it gives some nuance to, it's not as simple as people should just quit smoking when you see that folks are also smoking for various reasons and encountering a lot of different factors that continue to perpetuate smoking, even when folks are wanting to. In an empirical analysis, we looked at some longitudinal data, again, from the US population to identify a potential ordering of what may be happening among folks who are experiencing food insecurity and also tobacco smoking. And our finding here seems to suggest that it was food insecurity was really driving this level of psychological distress or level of stress, which was then impacting their use of tobacco use and so on. So this is an empirical example, a somewhat simplified feedback loop example that I alluded to earlier that we're seeing with some of the data. The last piece of research I want to highlight as part of this broad overview of where we are with this work and understanding the intersection of food insecurity and tobacco use among folks who are experiencing this from a public health and epidemiological perspective is in the lived experiences. And this is an example of a qualitative study that we conducted and published last year. And so in doing this qualitative work, we found out that, as you see in this middle graph, that there is really this clustering, inextricable clustering of nicotine dependence, food insecurity, and stress that people are experiencing. And it's not that this clustering is happening in a vacuum, but rather it's the social conditions, life course histories, including adverse childhood experiences and trauma histories, and their current health status that we're all feeding into this interrelated clusters. And this is not something that I put on the slides here, but one way to think about this from a public health perspective is the importance of syndemics, which are synergistic epidemics. So thinking about food insecurity and tobacco use as a synergistic epidemic in which one exacerbates the other. And so I think these types of theoretical understandings can push us to better understand and better intervene. To the right, this is really giving voice to the participants who were in this work, and what we found at the people level is that folks were smoking as a strategy to ignore hunger or eat less when they were experiencing food insecurity and having food shortages, staying addicted to smoking in the midst of instability. So when life is unstable and uncertain, smoking has been one of those factors that create that stability for folks. Smoking being prioritized even when there's financial strain, given all of these circumstances that have created this clustering and this importance of paying attention to life stressors that make it difficult to quit. And lastly, as I close, I'll end this presentation by emphasizing that we really need to address tobacco use and food insecurity in tandem. So we need food, not tobacco is a very apt theme that speaks to this. As a community-based public health researcher, the work that we're doing here in Cleveland, Ohio, is to try to address food insecurity as folks are undergoing smoking cessation so that when consumers are interested in quitting, that we are able to meet their basic needs that can then support their smoking cessation goals. And this work that I'm describing is still in somewhat of a nascent area, so there's a lot more research to be done. So this is areas for further research is to really understand this using multiple types of methodologies beyond the ones that I've shared here. And lastly, I'll end with my contact information. Thank you.
Excellent. Thank you so much, Jen. And thank you really for highlighting the relationship between food insecurity, tobacco use, and stress. I think this is very, very important and very telling for today's theme. Without any further ado, I would like to introduce Ms. Carrie Dahlquist, who is the manager at DC Health. Welcome, Carrie.
Thank you so much. I am hoping that you can see my screen. Let's see. Can everyone see that?
Yep, all set.
Oh, okay. Okay, perfect. I might have just messed it up again. Sorry. Can we start again? I'm going to start again because I just clicked something wrong. And here we go. All right. So that is not my first slide. I apologize. Just a moment.
Let me know if you'd like me to share your slides, if that's easier.
Sure. Yeah, let me see what's going on here. Okay. I think I've got it now.
Okay, awesome.
All right, here we go. So thank you again for inviting me to share information about our initiative to support tobacco use cessation and impact food security for residents in Washington, D.C. Today, I'll share background on how the project was developed, where we are in implementation, and the direction we are headed. So since the release of the first Surgeon General's report in 1964, public health initiatives have been quite successful in reducing the use of tobacco in the United States. Policies creating smoke-free spaces and restricting purchase age, as well as counter-marketing campaigns, have been critical to this achievement. But that is not the entire story. Those benefits have not been shared equally across all communities and populations, whether it is due to lax enforcement of policies, targeted marketing by tobacco companies, or limited access to cessation resources. Recognizing this, the Centers for Disease Control and Prevention requires all National Tobacco Control Grant recipients to address tobacco use disparities in their jurisdictions. The basic steps were outlined: identifying a population with disproportionate tobacco use rates, assessing the barriers to living tobacco-free, engaging a community-based organization with a track record of success addressing social determinants of health, and then working with that local lead agency to implement sustainable strategies supporting tobacco control initiatives. We wondered what activity or initiative we could add to the tobacco control toolkit that would reduce tobacco use disparities, but might also address a social determinant. So to determine our priority population, we looked at smoking prevalence in DC, where we noticed that smoking prevalence declined steadily over the past decade, just as it had in the United States. But for greater context, we considered smoking prevalence based on race and ethnicity. What we found is that smoking among white DC residents trended significantly lower than the DC and national averages. But we knew this was not the case across all racial and ethnic groups. While smoking prevalence has declined in Black DC residents, there remains a consistent and significant gap. This is the population with the greatest disparities in tobacco use, the greatest health disparities related to tobacco use, and a population experiencing systemic barriers to resources and services. So aside from the sheer addictiveness of nicotine, we know what drives tobacco use. Aggressive marketing and the lack of protections against secondhand smoke create environments where tobacco use can be viewed as socially acceptable. Meanwhile, social determinants of health create barriers to access resources and services. They amplify the stress often associated with tobacco use and make it difficult to get support for quitting. As we considered approaches through the lens of the determinants of health, we recognized the unique relationship between tobacco and food security. We hypothesized that we could possibly reduce food insecurity by reducing dependence on tobacco products. To illustrate this connection between tobacco and food security in the district, I want to share a snapshot of two different areas of the district. The first is Ward 3. So a little bit about DC. It is an urban population. It's about 10 square miles, and it's divided into 8 wards of roughly the same number of residents. Demographically, Ward 3 has the highest proportion of white residents and the lowest proportion of Black residents of any other ward. It has the lowest rate of smoking in the district, so low that in 2021, we do not even share that data. It is suppressed for reporting. Residents in Ward 3 have the highest rate of educational achievement, that includes some college. And while 6 of 8 wards have at least 6 full-service grocery stores, Ward 3 has the most at 13. Now, across town in Wards 7 and 8, the wards with the highest rates of tobacco use, the demographics are much different. Wards 7 and 8 have both the highest proportion of Black residents and the lowest proportion of white residents. While over 90% of residents in Ward 3 have pursued education beyond high school, it is the lowest proportion of any other ward, and they also have the lowest income. I mentioned 6 of the 8 wards have at least 6 full-service grocery stores. Wards 7 and 8 only have 4 between them. Oh, sorry. I really skipped ahead there. Oops. There we go. This is not to say that there are no other places to shop for groceries in Wards 7 and 8. Within that circle on the map is that area of the city. There are many farmers markets and healthy corner stores offering nutritious foods. Those corner stores, however, are more likely to have aggressive tobacco advertising outside and at the point of sale inside, as illustrated in these pictures that we took from the community. Knowing the role that social and structural environments play in access to healthy food options and the promotion and availability of tobacco products, it is really unsurprising to note that Black residents and current smokers are more likely to have experienced food security in the previous 12 months than white residents and those who never smoked. So this brings us to the core of our project, addressing tobacco use through the food access environment. Our goal is to reduce disparities in tobacco use and tobacco-related health outcomes among Black district residents who experience food insecurity. We do this by engaging non-traditional partners in the community to implement activities that support cessation and change the social norms of tobacco use through the implementation of sustainable policy systems and environmental change interventions through collaboration. So there are 6 components of the project, beginning with assessing and identifying the issues. I want to emphasize that while the steps are performed consecutively, they are very likely to overlap. We are also finding that we need to revisit each of these steps through the project. For example, we are always recruiting and training new partners to build capacity and monitoring and evaluating each step along the way. We continually monitor and evaluate what is working and what isn't working and the progress we are making. I would say one of the most important steps, though, is to listen and watch. Our partners and the people we are serving bring their knowledge and experience with them. We need to hear what their needs are and if we are reaching our priority audience in their needs. We are currently in the first year of the project and building capacity to implement the broader initiative. Leadership Council for Healthy Communities is a DC-based organization with experience working in both food security and tobacco control. They are serving as the lead agency driving the effort to engage stakeholders. Leadership Council has completed an initial assessment of corner stores in Wards 7 and 8. We are now working together to host listening sessions to get feedback from those most affected by tobacco use. And the first stage of implementation is complete in one area. DC Quit Now, our cessation services provided at no cost to DC residents, now links clients to local resources if they identify having experienced food insecurity in the last 12 months. Moving forward, Leadership Council will provide technical assistance to food access programs and agencies to help them understand the connection between smoking and having enough food. In turn, they will be able to share tools to connect their constituents to cessation resources, such as DC Quit Now. By incorporating tobacco assessment and treatment, the referral to cessation resources, into the regular practice of community organizations and agencies, we are building sustainability into the project. In addition to incorporating related messaging into a mass marketing campaign, we will launch later in 2023. The Leadership Council and the coalition of partners will do boots on the ground outreach to faith communities, multi-unit housing, and government agencies to support the project. We are planning continuous monitoring and are already planning our comprehensive year one evaluation report to determine progress and lessons learned. For the first year, we will be measuring our partner engagement, community outreach, and DC Quit Now utilization. We will also incorporate feedback from the community to measure how well we have done building out the program. Over the next 3 years of this project, we hope to see significant changes in resource utilization, quit attempts, smoking prevalence, and the ability of residents to access the food they need to live healthy, productive lives. The long-term goal, of course, is to reduce those health disparities and the morbidity and mortality related to tobacco use. So hopefully in a few years, I'll be able to share some really great data points with you. But that wraps up my presentation. Thank you so much. I have included my contact information. So thank you.
Amazing. Thank you so much, Carrie, for this excellent presentation and for sharing this great initiative with us. Now we have some time to get into the question and answer stage of our presentation. And what we will do is start with some questions that we have for our panelists. The first question that we have is for you, Carrie, and a participant wanted to know who are the non-traditional partners that DC is working with, and how can others identify these partners in their communities? And before you start, Carrie, just to let the participants know, please feel free to submit your questions in the Q&A box. We really want to hear from you. Thank you.
Sure, that is a great question. So non-traditional partners. So when we talk about non-traditional partners in tobacco control, it's any organization or group who has not necessarily seen the work they do as relating to tobacco control. I do see there is a question also about working with SNAP. And that is one of those kind of non-traditional partners that we are engaging. We are working both with our WIC, our SNAP, and our SNAP-Ed partners to begin incorporating these programs, this cessation support in the work that they are doing. But we are also looking at working with those businesses that are providing these products to the community, and what can we do to better kind of market and enhance their nutritious fresh foods that they offer, and point out that they don't really need to be reliant on these tobacco products to be successful. What they need is providing the resources that the community members need.
Excellent, excellent. Thank you so much, Carrie. We also have a question for Dr. Raphael Lencucha. So a participant says, and it's a bit of a long one, it's more of a statement and for your opinion. Low-income tobacco growing countries, for example, in Southern Africa, often face high external debts, which are in part serviced by revenues from tobacco exports in foreign currency. Although a future vision of a healthy planet and healthy people would mean switching to organic food crops for local and regional consumption, this would create a very difficult situation for these states. What are your takes on this particular issue? Thank you.
So this is a brilliant question and reflection, and something I think a lot about. We certainly have to approach alternatives to tobacco growing from various levels and dimensions. So I won't be able to adequately address this point because I think it really is an extensive conversation. And apart from moving to the philosophical or the sociological to think about what a global arrangement would be that would facilitate equitable interactions between countries, and especially in terms of a global currency, we can't quite engage at that level. So I take your point, and I think it's an important one. And I think that's also, if I might just add, that when we're thinking about alternatives, often the idea in people's minds is that we just switch from tobacco to another food-based crop for the international markets, and it will meet the same monetary needs of communities and governments. But we see that this structural feature of our environment applies across the agricultural system. So whether it's corn, whether it's soy, whether it's peppers, whether it's any of these agricultural commodities that are generated for cash, we see inequalities between countries, and we see actually the kind of structuring of inequity in the supply chains of these products, where farming households are at a disadvantage because they are reliant on the companies to provide the inputs through loans. The loans tend to be unfair and are given with interest rates that are higher than market value. And at the end of the season, they have to sell these products to the buyers at prices that that often don't even cover the costs of the loans that they've taken out. So there's certainly international structural features to this project that need to be considered. And I think you've identified a really important one.
Wonderful. Thank you. Thank you so much, Raphael. Well, we have time for one last question, and anyone can take this one. So as we all know, COP10 is coming up, and we wanted to know, how can advocates highlight this issue at hand, meaning the issue of food security and tobacco control more generally? Any takers? All right, I might have to pick someone if we're all being shy today. I am going to pick Jin, because I haven't heard from you today.
You know, my space is really in the public health space, and really with tobacco use and tobacco cessation. And for me, the advocates that I work with are folks who are about tobacco control from the cessation perspective, and to really highlight the role of food insecurity as it plays into folks' use of tobacco and difficulty with cessation. It's sort of implicitly understood, like these are the barriers that we have for tobacco cessation, and yet our smoking cessation treatments have not been addressing these underlying issues. And so that's a place that I think is more or less a lower hanging fruit that we can start with, to really think about the interconnections of these issues, and to say, if we address food security, then we will see better smoking cessation outcomes and lower tobacco use, which will then also feed back into better economic security for households. So that's my sort of long-winded answer to you. Thank you.
Thank you. That is brilliant. Unfortunately, we do not have too much time. We need to start wrapping up to answer any more questions today, but we will keep some questions in mind and we'll try to answer them via email. And I wanted to ask the panelists, do you have any closing remarks or anything that, maybe 5 words that you'd like to share with us today that you think we should, as a take-home message at all? And this can really come from any of you.
I will jump in and say that I think food insecurity and tobacco use seem to be insurmountable, but little steps along the way can make a difference. I became really interested in this work a few years ago, and I started seeing the research coming out about the connection. And it's tying those two things together that I think we're going to see some changes. And I think it's also expanding that work, not just what's going on in our community, but looking at how our local practices are affected by what's going on globally and how we affect what's going on globally as well. So every small change can make a difference in getting closer to a world free of tobacco, and also a world where people do not live with food insecurity.
Brilliant, brilliant. Well, we would like to start. I feel like I can't even really speak after what you just said, Carrie. It was just so well put, and it's just brilliant. Thank you for that. We would like to end the session and just to really thank everyone for taking their time to participate today on this very, very important discussion. I'd like to thank our panelists today as well for their amazing collaborations and for really educating us on this topic and the importance of this topic in a general sense, in a multifaceted sense, actually, nothing general about it at all. And with this being said, we will be sharing the presentation, well, not really the presentation, but I guess the recording with all of you. And if there are any questions, do feel free to reach out, and we'll do our best to also answer these questions. Again, thank you very much, and we will be in touch.